Dr. Ned Ketyer, who is a pediatrician and president of Physicians for Social Responsibility, Pennsylvania. He is a resident of Washington County, the most heavily fracked county in the Commonwealth. Ned is a member of the American Academy of Pediatrics Council on Environmental Health and Climate Change. He recently joined a newly formed group called PSNAP, which stands for Physician and Scientist Network Addressing Plastic and Health, to help educate health providers and the public about this urgent public health issue. You've done a lot of work talking about the health impacts of what it's like for residents to live in the proximity of any oil and gas infrastructure. And maybe you have some things you can share with us about some of the health concerns that people should know about.
The one thing about me is I don't really compromise on health, but we saw a lot of compromising in this film, didn't we? We saw politicians compromising health for jobs, for money, for progress. There's no job that's worth supporting if it directly threatens the health of your kids and my kids and all kids. Unfortunately, our politicians don't speak the language of science, and they certainly don't respect our health. And we know beyond a reasonable doubt that fracking for oil and gas and cracking for polyethylene scars the landscape, degrades the environment, contaminates the air and water and soil that all of us share. We know that it threatens the health, wildlife and aquatic creatures, farm animals, and even family pets. And we know that fracking and cracking makes people sick. The chemicals that come out of the ground from fracking, the chemicals that come out of the smokestacks and the flares when they crack at an ethane cracker plant, you know, a lot of those emissions are invisible. You can't see them except with a special camera. It's not a secret. The fracking companies know it. The fracking companies know it's dangerous. Shell publishes the chemicals that are of their greatest concern, and there's a whole list of them, many of them carcinogenic. Many of the chemicals are endocrine disrupting chemicals, which in very small concentration hijack our immune systems, our endocrine systems, and increase our risk for all sorts of chronic diseases and certain cancers. Plastic affects us in two ways. One of them is physical, the other is chemical. Physically, in the last 5 years, researchers have found microplastics everywhere they look in the human body, in every organ, including the brain and the heart and the placenta. They've even found plastic in babies' first stools, which shows us that babies are being born pre-polluted. Cancer rates, chronic illnesses are increasing in the United States in the past 35 years. And why do I mention 35 years? Since 1990, humans have created more than 75% of all the plastic ever made has been in the past 35 years.